In the clinical environment, one must consider three critical factors with regard to usability. The first is that devices are going to be used by a wide range of users, and that diversity of users includes not just differences in training and experience, but a variety of other factors such as sleep deprivation, distractions, workload. The second issue is that there's a wide range of use environments for a single device, from a patient using the device at home to clinicians using the device in a complex operating room procedure. The final factor is, will the device's user interface effectively support what the clinician needs to do at the time they need to do it? The operating room is a good place to see some of these usability issues in action. This is called a pressure relief valve. It's used to vent excess gas in the system. When it's closed, the gas stays in the system. When it's open, it's vented. There have been a number of situations where this valve was closed without the clinician appreciating it, and the excess pressure in the system caused trauma to the patient's lungs. The anesthesia machines have been designed with a number of safety features to prevent use error. For example, unintentional movement of the knobs that control the gas flow is protected by this bar. The different knobs have different shapes to help someone identify oxygen from air. In addition, one cannot turn the oxygen completely off. There's always some residual oxygen to deliver to the patient. On some machines, you cannot deliver too much nitrous oxide without the oxygen rising to match it. And one can see here that an alarm is going off from the excessive nitrous oxide. This device has a variety of usability issues related to the fact that it's so complex. There are so many different ways that one can manipulate the controls in order to modify the display. It's a full keyboard as well as a variety of other knobs and controls. And it can be very time-consuming in the operating room to use when the clinician has many other clinical responsibilities. This is actually an example of a very well-designed device in that it's intuitive, that if you squeeze the bag, you're delivering positive pressure, in this case oxygen, to the patient. It's called an intuitive mapping, which is in contrast to many other types of device design where the relationship between the user action and the device's response is not intuitive, and sometimes it's counterintuitive. When a device is designed in isolation, where the user's needs and requirements haven't been adequately considered, that device is potentially unsafe. Usability affects safety, and if I can't use a device in a crisis situation effectively, then I'm not able to respond to the patient's needs. There have been a number of situations where drugs have been administered in the intravenous line but never got to the patient because the stopcock was in the wrong orientation, or they injected it into the wrong IV tubing and didn't have it running. The use of the devices, the manufacturer often considers it for a specific indication, but once it's out there in the world, the indications often expand so that the user population and environment of a device's use typically expands significantly after it's released.
One of the most important problems we have in the operating room is delivering sterile supplies to the field, and therefore packaging becomes a very significant problem when the design is such that we have difficulty opening the product.
In a sterile fashion. One of the problems is a packaging like this, where you have to pull it open like this, and then you're supposed to drop it onto the sterile table like this. This is very substandard. It makes it very difficult to dispense the item onto the table without contaminating it.
Or this one. There is no method of opening it at all that will allow for a sterile delivery.
Product labeling remains a problem. Many drugs are packaged in ways that makes it difficult to distinguish them from each other. For example, here are two drugs with blue tops that are very different drugs, yet appear somewhat similar, and the labels are very small. So in a hurry, a drug that's put in the wrong place could be grabbed and given to the patient, and this happens very frequently. Intravenous infusion pumps raise a number of usability issues. Here in this patient after heart surgery is on 10 different infusions through 6 different pumps. Figuring out which drug is being administered to through which infusion pump can be difficult. In addition to issues with regard to patient safety, these heavy pumps on the tall IV poles can tip over and injure care providers. When a device's user interface design is flawed, it can promote use error. In addition, users may have problem recovering from errors. And finally, in a crisis or unusual situation, the device's use may, in fact, make the situation worse. A real problem in the operating room is the large number of cables and wires that are not only a tripping hazard, it's not uncommon to forget to plug something in and the battery runs out, or to plug in the wrong thing, to attach to the wrong device to the wrong cable. And these are obviously clear usability issues. The position of devices in a clinical work environment can result in problems, particularly with monitoring. In this case, an electronic record-keeping system located optimally for use. It blocks the vision of the clinician of a number of the other essential monitors and can often be in the way when the clinician is trying to interact with those other devices. One of the issues you can see very clearly here is they're managing the patient's airway, but they're having to turn 120 degrees behind them to see the monitors. Many hospitals are trying to go to 100% electronic or computerized record. However, there are a number of usability problems, and it's much more difficult in a computer to enter data that's very easy to do by hand. The increased emphasis on electronic record keeping has required clinicians to learn how to type, or to type more effectively in order to enter the data rapidly without distraction from other clinical tasks. Effective device design will allow a clinician to use a device correctly the very first time without the need for training or referring to manuals. Clinicians will, however, become more effective at using the device with additional training or experience. One of the issues with surgical devices is that many of them are designed in a way that it's more difficult for the surgeon to do what they want to do because of awkward hand positions, awkward body positions, and this can sometimes be frustrating and even affect the quality of the surgical repair. An effective design will incorporate users in the design process from the very beginning, and will consider carefully how a device will be used in the wide range of environments that it might be used in and the different types of users. There is a tremendous body of knowledge about human factors, usability, and interface design outside the medical domain, and I would encourage both industry and the government to draw on that expertise in their efforts to make medical devices more usable.